Hello everyone, I'm Dr. Victory. Welcome again. Today's topic is on dysmenorrhea and its effective homeopathic medicine. So dysmenorrhea, as you all know, it's also known as painful period or menstrual cramps. There is pain in the lower abdomen or the pelvis. Pain can radiate to the thigh or towards the lower back. Other symptoms that can occur along with dysmenorrhea are nausea, vomiting, diarrhea, fainting, fatigue, headache, migraine, disorientation. These are some of the symptoms that can occur along with dysmenorrhea. It has been estimated that percentage of female affected from dysmenorrhea can vary from 20 to 90%, and about 5 to 15% of the female suffer from severe form of dysmenorrhea which interfere in their daily activities. Dysmenorrhea are more common in female having their first menstrual period or menarche before 12 years of age. Female having irregular and heavy bleeding, having low body weight or thin people or thin female who are thin. Also, there is a risk factor involved, like women who have stress and depression, they tend to suffer more from dysmenorrhea. Also, family history of dysmenorrhea, it's hereditary. Female who smoke. In a study done in Turkey, it has been found that female who smoke, they suffer more from dysmenorrhea. Also, the intensity of the pain is more in them as compared to those who do not smoke. Even the intensity of the pain depends on the number of the cigarette they smoked daily. Dysmenorrhea is less commonly found in female who do regular exercise, also in those who give birth to a child at an early age. Dysmenorrhea improves with age, also following childbirth. Now, let's see the mechanism behind dysmenorrhea. During the menstrual cycle, the endometrial tissues start building up. The endometrium thickens because they are preparing for pregnancy. After ovulation, if the ovum doesn't get fertilized, in that case the already built up endometrial tissues is of no use since there is no pregnancy happening. So it starts to break down and start shedding off in the form of menstrual blood. During the process of breaking down of the endometrial tissues, there is release of a chemicals. They are prostaglandin and other inflammatory mediators. So these chemicals, they contract the muscles of the uterus, that is, they contract the uterus, which in turn constrict the blood vessels of the endometrium. In that process, there is temporary deprivation of oxygen. That is, because of the constriction of the blood vessels, there is temporary deprivation of oxygen to the endometrial tissues, which lead to the death of the endometrial cells or the tissues, and thus the breakdown of the tissues occurs. Due to continuous contraction of the uterus, the already dead tissues or the endometrial tissues are pushed out from the uterus towards the cervix, and from the cervix they are sent out through the vagina as menstrual blood. So the pain, that is the dysmenorrhea, is believed to be because of the contraction of the uterus and also because of the temporary deprivation of the oxygen to the endometrial tissues. Now, there are two types of dysmenorrhea. The first is the primary dysmenorrhea. In this, there is no underlying cause and the pain lasts for less than 3 days. Another one is secondary dysmenorrhea. In the case of secondary dysmenorrhea, there is an underlying cause. It can be because of ovarian cyst, it can be because of fibroid, that is the uterine fibroid, or because of endometriosis, or because of adenomyosis. So these are some of the diseases that can cause secondary dysmenorrhea. And in the case of secondary dysmenorrhea, pain lasts for many days even after the period ends. About 70% of adolescents suffer from secondary dysmenorrhea because of endometriosis. So the in the case of primary dysmenorrhea, the main cause is because of the prostaglandin and the other inflammatory mediators causing contraction and the temporary deprivation of the oxygen to the endometrial tissues. Now let's see some of the important homeopathic medicine effective in treating dysmenorrhea. The first medicine is magnesium phosphoricum in 6x potency. I have spoken about magnesium phos 6x in my previous video on dysmenorrheal tips. Kindly go through it. Indications for these medicines are: it's a great antispasmodic remedy for spasmodic as well as membranous dysmenorrhea. Pain more towards the right side. Pain is better by warmth, by bending double, by pressure. Back pain better by warmth. For menses too early, for dark blood, for stringy blood, that means the menstrual blood looks like a string. So these are the indications for MACPHOS. Method of taking the medicine is, you have to take this medicine 3 times a day. 2 tablets in the morning, 2 tablets in the afternoon and 2 tablets in the evening without water on empty stomach. Medicine is sweet to taste, so you can chew it very easily. If in case you have severe dysmenorrhea and it is not manageable, in that case you can take magnesium phos 6x in the same way every half or every 1 hourly. You can take this medicine every half or every 1 hourly till the pain subsides, reduces or disappears, in the same way without water on empty stomach. The next important medicine is Chlorphylum in 30 potency. Chlorphylum is a good woman's remedy also for spasmodic dysmenorrhea, severe pain fly in all parts of the body. Method of taking the medicine is, you have to take this medicine 3 times a day. Put 1 drop of medicine on tongue on empty stomach without water. Then again the same thing in the afternoon, again put 1 drop on tongue on empty stomach without water. Then again in the evening put 1 drop of the medicine on tongue without water on empty stomach. If in case here also if the pain is severe and not better, in that case you can give this medicine every half or every 1 hourly in the same way on empty stomach without water. You can give this medicine every half or every 1 hourly till the pain subsides, reduces or disappears. If in case you are not feeling better at all, in that case you can take both magnesium phos in 6x potency and Chlorphylum 30 alternately every half or every 1 hourly in the same way till the pain subsides, reduces or disappears. The next important medicine is Abroma augusta in 30 potency. Indication this is an Indian drug. Indication for these medicines are for irregular bleeding, for menses too short or too long lasting, menses profuse or scanty, dark blood, clotted blood, colicky pain in the lower abdomen, that is dysmenorrhea. Also hysteria with dysmenorrhea. Hysteria is unmanageable mental excess or unmanageable emotional excess where the person do not have self-control due to some fearful events in the past. Abroma augusta is also very good remedy for diabetes mellitus, diabetes insipidus, for insomnia, for debility, for vertigo. Method of taking the medicine is, again, you can take this medicine 3 times a day, morning, afternoon, evening. Put 1 drop of the medicine on tongue without water on empty stomach in the same way 3 times a day. The last medicine is Saraka indica or Jonosia asoka in 30 potency. This is also an Indian drug proved by Dr. Andy Ray of Kolkata. Indications for this remedy are for delayed and irregular period, for dysmenorrhea, scanty, pale and watery blood, sometimes bad odor, for blackish blood, clotted blood. Method of taking the medicine is again same. You have to take this medicine 3 times a day in 30 potency. Put 1 drop of the medicine on tongue. Empty stomach without water in the morning, again in the afternoon, again in the evening in the same way without water on empty stomach. So these are the 4 important medicine for dysmenorrhea. That's all for today. In my next video, I'll be talking on tips on becoming a confident and successful practitioner. So take care friends. Do like, subscribe and share my channel. Stay safe, stay healthy, stay at home, take precautions. Bye.